around the house, maybe with some non-medical home care? That's going to be today's topic on Ask the Experts. I'm Robert Allen. We're here for the hour with a representative from 24-Hour Home Care. Diego Chacon is joining us. He's the Director of Admissions. He's going to explain a lot of stuff to us about how to see whether you might qualify for needing help or whether you just need some part-time help, full-time help. Diego, thanks for joining us.
Yes, Robert. Thank you for having me. Happy to be back.
Well, it's our pleasure to have you. We had an enjoyable interview last time. We're going to take it to another level here today. Just going to ask you all kinds of good questions. But before we go a little further, I just want to give out the website. 24-Hour Home Care is the number 24, HR, cares, with an S.com. 24, that's the number 24, letter H, letter R, cares.com. Check out that website for information as well. If you are just catching part of this interview, don't have time to listen to the whole thing. So, first of all, let's expand on for people what exactly is non-medical home care.
So the scope of practice for non-medical home care consists of personal care assistance, bathing, dressing, assistance to and from the restroom, light housekeeping, meal preparation, transportation, companionship.
All right, so the types of things that are activities around the house that we might normally perform for ourselves, but because maybe we're getting older and not as physically capable, or in some cases, I guess, even if people are recovering from surgery or something, they can have your services as well.
Exactly.
Okay, cool. So the services provided, I think, fall under what is sometimes called activities of daily living.
Yes.
All right. So, is there any particular, as far as qualifying goes, do you actually go and visit people's homes and figure out whether they need these services or not?
Sure do. So we initially conduct an in-home consultation where we review an assessment. So we work with the patient to see either the patient or any individual involved in their healthcare decision-making process to determine what will be needed on a day-to-day basis, whether it's bathing, transfer assistance, any sort of personal care, things to that effect.
Okay. And am I correct? You guys will actually go visit someone at their home for a free consultation?
Completely free of charge.
Okay. And if I remember from last time we spoke, you're also available 24/7 even for those consultations.
24/7, nights, weekends, holidays.
Yeah, so folks shouldn't be shy and say, well, I can't call because it's Sunday or whatever, while it means that you or one of your coworkers has to head out there on a weekend. It's still about taking care of the client, and if they feel the need, they shouldn't hesitate.
Correct.
And by the way, that number to call is 480-219-4434. 480-219-4434. Diego, that number is in the Scottsdale area. Is that the number that our listeners valley-wide should be calling?
Yes, that's the best number to reach a representative 24/7.
Okay, all right. And you have other offices around town?
We have one brick-and-mortar office per se, but we provide services throughout all of Maricopa County. So
okay.
Our office is in Scottsdale, but we recruit our caregivers throughout.
Okay, so 480-219-4434 for any help you might need in non-medical home care throughout the valley. That number will at least get you then set up with a person that's more directly in your area. So tell us about the folks that actually go out into people's homes. What are their qualifications why I would want them to come to my home?
Well, initially we begin with a background check. They must have work-related references, so they must have care outside of family and friends, whether it's for another agency, working with another hospital. They have to be vetted by qualified employment. They must first come in for an interview, to interview with individuals such as myself, our general manager, and our human resources manager as well, to see if they're fit for the job, not just there to pick up a paycheck, and there for the right reasons.
Okay, so your interviewing process is even a few levels of hurdles. A person's not just going to come in and interview with one person. They're going to get a little different type of interview, maybe with a few different people within 24-hour home care, and then you have to collaboratively agree that that person should be hired.
Correct. It's
Okay.
a pretty strict process. It's a 24-point process. We only hire about 5 out of every 100 candidates that come through our doors.
Wow. Okay. So the people working at your place are the cream of the crop if they're 5 out of every 100. Good to know. Good to know. So what about stuff like, I need help with cooking, or maybe I even have a restricted diet. I mean, myself, I've recently had to adapt to what they call gluten-free diet. I'm having some, allergy issues with that. Is that something that your providers can care for and take care of?
Absolutely. I mean, in many instances, differing diagnoses require differing meal plans. And we've heard of situations in which either family members or privately hired caregivers would cook something quick, microwavable meal, or something that, is fast and easy. And in most instances, those have either high sodium content or potentially high sugar content, which could be catastrophic for certain diagnoses such as, diabetes, and so, we've implemented this diagnosis-specific cookbook. It's called Whole 24, and it's creates meal plans for diagnoses such as diabetes, COPD, renal and kidney, healthy heart, healthy aging, memory loss, and the recipes also include kosher meals as well for patients that require kosher meals.
All right. Pretty cool. So now, are there certain caregivers that are more inclined to go out, say, for a restricted diet situation, or are they going to refer to the book that you guys provide?
Well, this book is required in training for every single one of our candidates. So once they do pass our interview process and their nationwide and statewide background checks clear, we bring them in for a 5-hour orientation, and this portion, the Whole 24 training process, is implemented within each individual orientation class.
Excellent. Okay. Good to know. So, home care organizations like yours, it sounds like you guys are pretty thorough. Your people are, very much vetted, and they're also, given a wider range of qualifications dealing with things like these restricted diets and all that. Explain to us how your home care organization is different from other types of home care organizations.
Sure. Well, I think specifically just our hiring and screening process, and our requirements for nationwide and statewide background checks. There are differing structures within the home care industry, whether it's, a registry or private hire, or like us, a full service agency.
Okay, so full service agency is how you guys are designated. Now, is that any type of governmental oversight that is, or is just that that's what you provide?
There's local organizations, such as here in Arizona, the Arizona Non-Medical Home Care Association, which requires the caregiver bonding, insurance, and things to that effect. But there is not any sort of state legislation here in Arizona that requires onboarding caregivers.
Right. So it's not a regulatory thing per se, but it is guided by groups that oversee these types of things. Sort of maybe, would they be considered kind of like a watchdog type thing or something? Is that kind of what it is? Or an association of home care places?
Yes, an association of home care places for best practices within the industry.
Okay. All right. And again, full service agency then, that is still what would be more of the higher level than just a registry, I guess. What that says to me in terminology is just a place that literally has listings of people that are home care providers, but that there's not an organization backing them up.
Exactly.
Okay. All right. We're listening to Diego Chacon. He is the director of admissions for 24-hour home care. They're based in Scottsdale, but they can help you throughout the valley, throughout Maricopa County. Their website is the number 24, letter H, letter R, cares.com. We'll be talking to Diego for the hour about what type of help you can get at home, whether you may need it or not. And they offer a free in-home consultation. Give them a call at 480-219-4434. Again, 480-219-4434. And this nice young man, Diego, will come out and help you out. Stay with us. We'll be back in a moment. Non-medical home care is what we're talking about here at Ask the Experts today. I'm Robert Allen, and we're joined by Diego Chacon, Director of Admissions for 24-Hour Home Care. Diego, welcome back.
Thanks for having me, Robert.
It's our pleasure. You know, I want to mention one thing from a personal standpoint on this. I did some caregiving for my parents years ago, and something that I want to point out, I know from our previous interview, your company does not have a minimum amount of hours, that you'll come out for an hour to help someone, correct?
Correct. We can help for as little as 30 minutes to around the clock.
Yeah, even 30 minutes. Okay. When I was seeking out non-medical home care type stuff for my parents and that, 4-hour minimum, and if you couldn't afford the 4 hours or whatever, it was tough luck. I mean, they wouldn't send somebody unless they could get a 4-hour billing out of it. So I want to stress that this is a really unique situation for a home care company to do this. Check out their website, the number 24, hrcares.com. And another personal note, when I was a caregiver, and I know many caregivers out there that are taking care of a family member, a parent, or a child or whatever, you push yourself to the point that's not good for your own health, and you hold off and you hold off and you hold off until you call a company like 24-Hour Home Care. And my point to you is the lesson I learned in life was that it would have been better for me to have gotten some help earlier on, because then I would have had caregivers that would have gotten accustomed to working with my dad and so forth. And then when a situation happened, as like what happened in his case, my dad lost a part of his leg to diabetes, then it was like, what do I do now? Now I'm the home caregiver, and I'm in a jam here, and now all of a sudden I've got to scramble to get people to help a whole lot more. If I would have brought people into our lives earlier, those people would have just transitioned into the change in my dad's life. So I want to encourage people that are listening, don't wait until you just have a huge burden. Get some help gradually. It's not against the law. It's nothing to be embarrassed about. Just do it. And that number, 480-219-4434. Diego, the situation I just described there, I'm thinking that you frequently run into situations when you go to do a free consultation at someone's home that the people you're dealing with have reached their wits' end.
In most instances, yes. I mean, oftentimes we're dealing with family members who either take time off work to care for their family member, and they may need more assistance than they initially thought. And the last thing that either of them need is for the family caregiver themselves to be getting sick. And that's when they're reaching out for help.
Yeah, and regarding that reaching out for help aspect, one of the points, that you and I were discussing during the break that we should share with the audience, your company, 24-Hour Home Care, as a full-service agency, not only do you offer more, as far as types of services and specifics and the book we discussed, restricted diet help and that sort of thing, the additional thing is you could have a backup person. If somebody does an independent hire, through an ad that's in the personals and Craigslist or whatever, if that independent hire, that one person, if they get sick, if they have a car accident, then you're stuck. Whereas your full-service agency has numerous people to call upon that could jump in if the caregiver you send themselves has an emergency and can't make it.
Exactly. In those sort of instances of a private hire, they just have maybe themselves, and if they're, unfortunately sick or something happens, they're stuck without care.
Yeah. And now with a registry style setup, I don't know, maybe they could get you a backup person, but in a registry environment versus a full service agency that knows and vets all their people, a registry, I don't know, what are they doing? If someone can't show up at my house, they just go to their little black book and they say, who's in that area, who can we send? But that person isn't going to have a big background on what my needs are.
Exactly, and oftentimes it can't even be within the same day sort of assistance. It might be later in the week. It might be the following day.
Yeah.
It's not someone who's familiar with that individual situation.
Yeah. All right, well, look, in life, bigger is not always better, but in this case, having that backstop of other people at an organization that's available 24 hours a day is a good recommendation. Check out the number 24, hrcares.com. We're talking to Diego Chacon. He's the director of admissions for 24-hour home care. They provide non-medical home care. Now, regarding that, though, make a distinction for me, Diego.
Sure.
How far does non-medical home care go? Is it considered medical if I need to send you over to my dad's house and he needs to have an insulin shot or something like that? Is that still under your care or someone that you can send at all?
You know, an insulin shot is essentially out of our scope of practice.
Okay, no needles.
No needles, any sort of wound dressing, medication administration, that is something that we cannot help with.
Okay, so that involves either a registered nurse or something to come or whatever.
Yes.
So the folks that are with 24-hour home care, we were discussing how strongly you vet them and they're trained and what their background is. Do they have any designation? Are they CNAs or anything? What is their actual?
We do have many CNAs on staff, certified nursing assistants. In many instances, when working in either a memory care community or some sort of skilled nursing setting, they do require that sort of designation to provide care in the facility. But typically, while in the home setting, it's professional caregivers, individuals that have worked with patients on a one-on-one basis.
Okay, all right, very good. Let's talk about the money a little bit because obviously, this is great service that can be available to folks, but it's got to be paid for. So how does this work ranging from private pay to insurance? Give us a little outline on that.
Sure. So, something to consider, and for some individuals, the registry or private hire might be a benefit because it is traditionally a much lower hourly rate. But something to consider is the fact that if something is, say, $12 per hour to have an individual come to your home, what insurances are they paying on top of that? How much are they paying their individual caregiver per hour, and how much are they receiving as in a business aspect? You do have to pay for the bonding of a caregiver. If something is accidentally broken while cleaning and needs to be replaced, or, if an individual's hurt, oftentimes that liability rests on the patient, as they are, in most cases, considered the employer.
Oh, okay. So I'm picking up the responsibilities as the person getting the care for some of those things that your company, 24-hour home care, has under its umbrella.
Yes.
Okay. All right. Good to know. Now, as far as the actual, typical cost, you were saying that an independent hire might be a little bit less money or whatever. Does any of this come into insurance? When you yourself go to someone's home for a free in-home consultation, are you able to lay out those structures to people to show them how, what to expect, what it will cost, or whether there is any? I'm trying to think, what do they call it with, there's a particular type of insurance for getting,
like private long-term care insurance?
Yeah, I'm sorry. Thank you. Yeah, private long-term care. Does that enter into this at all?
Yes. So for us, we do accept private long-term care insurance, but for an individual that is a private hire, say from Craigslist, that's not something that would apply. Yeah,
they wouldn't even be set up to even be able to even begin to do that.
No, the individual would have to have some sort of business license. It has to be an actual full-service agency.
Okay. All right. Let's review for folks who might have just tuned in this aspect of what's called activities of daily living, which is non-medical home care. If I need help for my folks, if I need help for maybe even a child that's incapacitated in some way, has a handicap or whatever, what things, again, coming into my home, what can you do for me?
So any sort of personal care assistance, bathing, dressing, assistance to and from the restroom, light housekeeping, meal preparation, transfer assistance, transportation, companionship, and medication reminders.
Okay. I don't want to turn you into, like the cleaning lady or anything, but can you throw a load of laundry in for me or what?
Of course, throw a load of laundry in, help you iron, pretty much anything under the sun that doesn't involve re-roofing a house or repainting a living room, replanting a garden.
All right, so activities of daily living, beyond even just personal care, like you say, like hygiene, bathing, helping somebody get dressed, that sort of things. This is a home helper for people that are either, they're getting older, they would rather stay home is what this is really about. I mean, this is still way less expensive than going into a facility around the clock.
Very true.
So, companionship, can you drive people to the store to pick up groceries? Is that an insurance issue, or can you do that?
No, not at all. We do have automotive insurance as well, so we can help with driving an individual to the doctor's appointments, or if an individual's discharged from a hospital setting, taking them home, picking up groceries, filling medications, and getting them tucked in and situated at home.
That's excellent, too, because I know that there are companies that specifically do non-medical transport to the doctors, and I bet that costs a lot more money having them do it than asking your caregiver to just give you a little hand doing that. Excellent. 24-hour home care is with us today at Ask the Experts, talking about things you might need around the house if you're getting a little older. Stay with us. More with Diego Chacon when we return. Welcome back. This is Ask the Experts. I'm your host, Robert Allen, here today with Diego Chacon, a young man that is mature beyond his years, and we'll talk about him a little bit too. He's with 24-hour home care. Check out their website, the number 24, hrcares.com. Free in-home consultation if you need some help with what's called activities of daily living. That's everything from cooking, cleaning, bathing, getting dressed. Maybe you need a load of laundry done. Diego said they'll even do that. Take you off to a doctor's appointment if necessary. Really good company, a company that even their minimum time they'll come and give you care at your home just even for 30 minutes, an hour. You don't have to have a 4-hour minimum, which is a really interesting model that they have. Very, very progressive model. Diego, thanks for joining us.
Thanks for having me, Robert.
Pleasure. When we were at the commercial break, again, it was always some conversation off air, but we've always got to share that with the audience. I was asking you whether or not, beyond just maybe helping older citizens, which is what we tend to think of with 24-hour home care, what about folks maybe with some kind of a mental issue or whatever? Could be a mentally handicapped child, could be an older person, or even a younger person who had a stroke, someone who's bipolar. And you were saying that those situations are things that 24-hour home care can also go out and help with.
Absolutely. With companionship comes a laundry list of things that we can help with, whether it's redirecting an individual to keep them on a more positive path, taking them out for socialization, just keeping them happy in a sense. But oftentimes where family members are providing care and an individual might not be of most sound mind, they'll definitely need some sort of help with our sort of care.
Yeah, so as long as a person who's maybe bipolar or if they're schizophrenic or something like that, as long as you know that they have proper medication, they're not going to act out, and they just need some help. People like that sometimes are just reclusive, and they just maybe need help around the house as well. That can be taken care of. Give a call to 480-219-4434 for a free in-home consultation if any of these situations sound like something you're dealing with. And I'll say it again, when I dealt with these situations in my own family, I really waited too long. I tried to just be the one taking care. But then when things got big and out of hand, then I was in trouble. So even if you are taking care of a family member at home yourself and you're doing okay with it, still get started sooner rather than later, because as life goes, our health tends to get worse, not better. And a family member you're taking care of, maybe a senior citizen, if their health problems advance to where you can't handle them, it is better to involve a company like this now to get to know them. They get to know you. They get to know your needs so that when your situation accelerates, they can just pick up with it. They don't have to come in to this going off the rails freight train. It's a strong recommendation I make from my own personal experience. Again, 480-219-4434. Diego Chacon visiting with us today. He's the Director of Admissions, a free in-home consultation. He can come out or some other folks on his team can come out, and it's valley-wide. If you need their help, they're glad to come out and give you some advice. Diego, as far as these types of situations where people have, permanent handicap versus someone who's just, maybe recovering from hospital stay or whatever, how are those approached in any different way?
Well, initially we can work in a hospital setting. We can work closely with case management or social work to work together to complete a care plan. If it's an individual that's hospitalized for the first time, we can set up discharge plans, have our caregiving staff actually shadow in-house hospital physical therapists and occupational therapists so that we can work together to have those best practices in the home.
I mean, that's fantastic. So I'm sitting here, I'm saying Diego will come out, free in-home consultation. What you're telling me is that you will go and interface at the hospital before someone's even released to know how to have the ball passed to you.
More often than not, I myself individually am the one that's going out to the hospital setting. So, yeah, it's working with the rehab teams and just ensuring that we're following those, exercises to get them back to fighting shape.
Boy, that is just, yet again, as I said, my own experience with home care agencies. This to me sounds like yet another advancement that you guys, another level that you guys at 24-hour home care have taken to.
Thank you.
That's really great. 24, the number 24, letter H, letter R, cares with an S.com. Check out this company. They're available literally 24/7. Diego has shared some stories before about, I think you said you went out to someone's house. Was it on Christmas Eve even, or?
That's correct. Christmas Eve this last year, we're able to coordinate care the following day to begin on Christmas.
Fantastic. So your needs will be met, folks. Give them a call, 480-219-4434. Diego, you have an interesting story in your own life of what background even you had personally before doing this as a living. Talk about that.
Yeah, well, before getting involved in the industry, my grandmother, before she passed away, moved in, and as a family, we're helping to provide care for her and helping her out in sort of any way we could. But after it got to a certain point, she needed additional assistance and more assistance than my mom or my dad was able to help with, or myself. And in that process, it was just differing person after differing person, and we went a route that was not any sort of full service, and unfortunately had issues of theft, whether it was missing medications, and it was just really tough on my family, and even tougher on my grandmother, and now being involved in this industry, it's just sad to see how highly unregulated things are, and that definitely stuck with me forever. And you really got to put yourselves in these individual situations where they're reaching out for help. And, you just got to understand that people just have a lot going on, and you really just have to, I guess, sorry, Robert, again, tough. But
No, listen. I absolutely know that feeling. If you have the type of personality that has empathy toward others, you don't want to see your loved ones suffering, and you want to take care of them. Now, you're saying that in your own family, you ended up with some situations where the people maybe couldn't be trusted or whatever. Would you say for your own family, was that an issue of just, being ignorant of how to go about finding someone, or was this a situation where you maybe couldn't afford the better care, a little bit of both?
I think it was a little bit of both. It was at a time, I would say about maybe 4 or 5 years ago, where maybe home care wasn't as prevalent as I would say it is today. And we just had never reached out for help. My grandmother never needed additional assistance, and it was something that we thought we could take on our own, and it was a heavier undertaking than we originally expected.
Yeah, that's I have to second that one, because you feel like you're doing the good family thing, but you're right. You don't fully understand what you're getting yourself into.
No.
Yeah, I mean, when you think about all the things you have to just do for yourself every day, you get up, you take a shower, you get your breakfast, whatever. You got to do all these different things, and when you're having to do that for another human being, and that human being on top of it maybe isn't the most mobile and agile and all that stuff, I mean, there's a lot of safety issues involved in this and everything. So you need professional help with this type of thing. And, you know, I guess I would say I was fortunate. I never had any accidents or anything, like in helping my dad or my mom, you know, everything from taking a shower and various things like that. Maybe I did a little bit of research or whatever, but I was pretty much on my own for the most part. So I guess I would consider myself fortunate. But, you know, that's all you need is you're trying to take care of a family member and they slip and fall in the shower or something. It's like, and I'll tell you what, I know that when home health care people started to help us and I would see what they would do, I learned their tricks of how they transfer someone, you know, from a chair and that sort of thing. And it was like, wow, you know, that's really logical. That makes total sense. And if I had known that, I wouldn't have been going to the chiropractor for my own back right now, you know, trying to get my dad out of bed or whatever, you know. So, I mean, there's both sides of this. You know, you end up where it's not just even the care of the person, your loved one that you're, you know, looking out for. Your own health starts to compromise because you start doing stupid stuff, you know, which you just out of ignorance is all it comes down to. Diego Chacon is with us. We're talking about activities of daily living and 24-hour home care. 24-hour home care is the subject, and 24-hour home care is the company. Check them out at 24, that's the number 24, letter H, letter R, cares with an S.com. Good company, I can tell from my own personal experience. Definitely give them a call, 480-219-4434. One more segment with Diego in just a moment. 24-hour home care is here in studio with us, taking good care of us here today. We're with Diego Chacon. He is the admissions director over there, and he'll come out and give you a free in-home consultation if you need it, if you're needing it for yourself or whether you're needing it for a family member. That family member might be your mom or dad. That might be a child you have that has a disability. They can help you out. 24-hour home care. Check them out at the number 24, letter H, letter R, cares with an S.com, or call them up. Go straight for it. Call them up for that free in-home consultation. 480-219-4434. Diego Chacon, who's joining us in studio, he learned about all this stuff initially before his business experience with his own in-home situation growing up with his family when Grandma came to live with him. We were talking about that. So, Diego, you know, you said that some things that you were doing with trying to take care of your grandmother and all that, they didn't always go, you know, exactly the right way. So tell me one or two things that you might have made a mistake on that would be things that would never happen with 24-hour home care.
Well, I think I would initially interview the individuals before having them initially walk into my home or provide care for my grandmother. I think
so
that would be.
You just totally trusted people that showed up and said, I'm a caregiver.
Exactly, and we were never told in advance who's coming out. It was just different people every day in and out. I mean, I'm sure you wouldn't like different people coming in and out of your home every day. And,
no, I mean, you want to get a little familiarity that the person knows what your wants and needs and whatever are. You want to be treated personally like that.
Absolutely. And I think just having an understanding of, you know, her moving in there, not to take on too much, you know, is just too much for the family to take on. That aspect alone was the biggest mistake.
Did your grandmother have any particular health issues, or was just getting old and frail?
She had a stroke.
Wow. Okay.
Yeah, she had a stroke, was discharged from a rehab facility, was living on her own, and just decided it'd be best for her to move in, sell her home, and she had the last of her days there with us. But
yeah, well, I mean, look, even if, you know, everybody can always look back and say woulda, coulda, shoulda, your family still did help her, did the best they could. You can always look back but that, I think that learning experience is so important for folks to understand that are listening right now, that for you to come out to their home, this isn't just a business. You really know this from a real life experience. So that's why, they should fully take advantage of the free in-home consultation and have you come out. I want to talk about something else too. And this is something I know just kind of learned, myself through going through some of this. The idea of elder-proofing a house. People, when they have a young baby, they go through this child-proofing. Let's make sure the sockets are covered, and let's make sure that there aren't, tables that can tilt over and fall on a child, things like that. There's a whole art and science of elder-proofing a home as well, and I think you guys get into some of that.
Definitely. One aspect of our in-home consultation is a home evaluation. So we conduct the initial consultation, for example, in the hospital setting, and if the individual is, non-ambulatory or has any sort of, is now wheelchair bound, it's installing ramps in the entryways of homes, ensuring that there's not a raised entry to showers, grab bars in the restrooms, proper devices such as like a Hoyer lift installed in the home prior to them getting there, just to avoid an additional hospitalization or another fall. It's something that's really necessary before bringing them back to the home.
Yeah. So you walk into a home with the eyes that are looking for those things that a lot of people aren't going to think about. There might be some similarities to baby proofing, but for an elderly person, it's, or a handicapped person, it's not going to be the same as a baby. So it does need the eyeballs that will know what to look for. And especially, kitchens, bathrooms, these are where a lot of the accidents happen. Thing you mentioned about maybe, people having loose type, carpets and things that need to be affixed more and all that. I think even down to, when you're looking at, dressing someone, I know I went through some of this stuff, easier to have Velcro attached shoes than laces that can come loose and trip over, things like that. So there are so many nuances to look at, so many things to be aware of. Let's take another couple moments here and give us like you're walking into, my home to check this out, because I know there are folks listening that need to make the call. I know they're still shy to make the call, but let's go ahead, give them some education right now anyway, and they'll be maybe more encouraged to call when they do need the help. So you go into someone's home. What are you looking for? You got to know what the person, what their health condition is and combine what they need, but go ahead and evaluate.
Yeah, first and foremost, before even entering the home, I look to see if it's a single-story home or a two-story home. I look to see if there's any sort of side entry or if there's, stairs entering the home. That's obviously going to be some sort of issue for an individual that's wheelchair-bound or something to that effect. Once entering the home, looking at the floors to see if there's any throw rugs, exposed cords. If going in each individual bedroom, also looking for trip hazards. If there's a step down tub or, sometimes sliding glass doors can be loose and can lead to, if they're using that as a grab bar, they pull it off the hinges and the glass shatters. So those are all things that we take into consideration.
Yeah, so it's a thorough inspection of the environment to make sure that it's going to be safe, how it's used. What about for people that are in a home care situation, they start needing certain equipment? They need a walker, they need people have the cane with the 4 little feet on it to stabilize themselves. Maybe they need a little electric scooter. Do you guys get involved in any recommendations or steering people toward, if I recall, I think that there was one time when my dad was able to even go to his doctor and get a prescription for something, and maybe he needed one of those chairs that helps lift him out or something like that, and it was help be paid for or whatever. So can you get involved in any of that stuff?
Of course, directly we don't provide those items, but we do have resources such as other home health agencies that can provide, or hospice agencies that can provide the Hoyer lift or can provide some sort of gait belt to help with the transferring process. Oftentimes we do require a gait belt, which is essentially a lift that sits near the bed.
Right.
If it requires a 2-person transfer, that can have our caregivers get hurt, and of course the patient, is in a ton of danger if it requires two people just to lift them.
Yeah. Okay. So So like you said, you're not the provider of those items, but again, you're the eyeballs that will look at the situation, make recommendations, and say, hey, folks, you could use this, you could use that, and give people the guidance.
Precisely.
All right. So again, free in-home consultation. If you come to my house, this sounds pretty thorough. How much time do you think we're spending together in this evaluation?
Well, typically we like to say it takes about an hour throughout to finish the whole process, but I mean it can be as quick as your questions would allow, I suppose. But usually it takes about an hour.
Okay, so an hour, give or take, to cover these aspects of what types of activities you need help with, to check out your home, to maybe talk to you about certain needs. Now, with caregivers, what if you send somebody to my house and I just don't get along with them?
Sure.
What's going to happen? You're going to send somebody else? How's that going to go?
I mean, exactly that. I mean, we would just prefer that any sort of grievances that you have, if you just, knock heads, just call us and we can send someone out that best fits your needs.
So when I'm elderly and I need some help around the house, Diego sends out a caregiver. She just happens to remind me of my ex-wife, and I say, no, buddy, no way. We just can't do this. And Diego says to me, but I'll give you a discount. No, I'm just kidding. Anyway. All right, 24-hour home care we've been talking to for the hour. Diego Chacon, he's a nice young man. He's got personal experience with his grandmother in this. It kind of led him down the direction of doing this for a living. I really, really can't recommend enough that you have him come out to your house if you need some help, whether that help is for yourself or whether you need help, for a loved one, whether it's one of your parents or even, as we said before, a handicapped child, whatever it is, even someone with the cognition aspect of things, stroke, mentally handicapped, bipolar, as long as the person is properly on medication and everything and there's no dangers involved of any kind of, person doing anything that's going to be dangerous itself, they can deal with those situations too. Diego, we just have about a minute or so left. Anything that you want to implore to people? Go ahead.
Well, definitely do your research before reaching out. I mean, again, as I've mentioned, hundreds of home care industries here in the Valley, each of which implement their own hiring and screening process, and really take your time with the process. If an individual, your mother, for example, is in the hospital for, say, 2 weeks till discharge, start immediately. Start interviewing those companies and get the ball rolling. The last thing you need is, for a discharge date to potentially be pushed forward, and you're unequipped to help.
That's an interesting thought too. You're anticipating a discharge date and you got it on your calendar, but now they are 3 days ahead and you're like, uh-oh.
Yes, yeah. It can happen.
All right. Again, Diego Chacon, reach him at 480-219-4434. 480-219-4434. Scottsdale-based office. But we were talking, he travels wherever, Peoria, Apache Junction, Cave Creek, the whole valley. They can come out and help you. They can get someone then is a local caregiver to come to your home, and they'll give you someone that you like. Visit the number 24 HRCares.com. Thanks for listening. Make the call, folks. He's a nice guy.